Assalamu alaikum, dear students. Welcome to that fourth session of that one multiple choice question. In the previous three sessions, we had discussed the different aspects of the multiple choice question, which include the various types of MCQs, the anatomy of MCQs. Then we discuss the pathology of MCQs. We also discussed then the different types of pathologies, and for that the management as well. These four parts have been discussed till now, and in this fourth sessions we will discuss the manage the technical flaws which are very common to teachers to the MCQs. Let's have a recap what we have discussed in the previous three sessions. So we discussed the Miller pyramid. Then we discuss the different types of questions which are including the written assessment. They are the multiple choice question and the open-ended question. We discuss the strength and weakness of MCQ. Then we discuss the anatomy or structure of MCQ. We discuss the context-free and context-rich question. Then text alone and illustrated text MCQ. Then we discuss the R-type, extended मैचिंग क्वेश्चन उसकी नोट में डिस्कस की एग्जांपल के साथ देन वी डिस्कस टू डिफरेंट रूल्स फॉर राइटिंग द एमसीक्यू after that we discuss the levels of questions which we can simply call as the easy question, the average question and the different question in which हमने ये डिस्कस किया कि जो नॉलेज है एंड ये इसको हम C1 कहते हैं, फिर C2 कंप्रहेंशन है, फिर एप्लीकेशन C3 है एनालिसिस एंड लेकिन इसी को हम इस तरह भी कर सकते हैं कि C1 C2 C3 तीन में भी कर सकते हैं कि जो नॉलेज एंड कंप्रहेंशन है इसको C1 कह सकते हैं, एप्लीकेशन एनालिसिस C2 है एंड सिंथेसिस एंड इवैल्यूएशन या इवैल्यूएशन एंड सिंथेसिस जो मॉडर्न न्यू डोमेन के मुताबिक है क्लासिफिकेशन टेक्सोनॉमी के मुताबिक, तो ये C3 है। या इस तरह भी कर सकते हैं कि नॉलेज जो है जो बेसिक स्ट्रेट फॉरवर्ड क्वेश्चन दिस इज C1, कंप्रहेंशन दिस इज C2 एंड देन एप्लीकेशन C3 एंड अदर जो है ये डिफिकल्ट में आते हैं, सो इजी, एवरेज एंड डिफिकल्ट। Then we discussed some examples and how उसकी जो गलत फॉर्म है और सही किस तरह लिखेंगे ये हमने डिस्कस किया। हमने वेनिटी जो है पर डिस्कस की कि हाउ इट कैन बी रिटन एज, उसकी स्ट्रक्चर क्या होगी और उसकी कौन कौन सी इंफॉर्मेशन जो है ये मस्ट होनी चाहिए उसमें। Then we discuss some examples for that. After that we discuss in detail in the third session. यहाँ तक जो हमने discussed that was the two session. In the third session on the multiple choice question, we discussed the pathology of MCQ, in which we discussed in detail about the content under representation and the construct irrelevance variance. Then we discuss the management of pathologies through the blueprint. And now we will discuss the common technical flaws which are related to the MCQ. These technical flaws, we can say that commonly mistakes in the writing and construction of the MCQs, they can be divided into two broad categories, which we can call as related to the test-wiseness and related to the irrelevant difficulty. So initially हम जो है टेस्ट वाइजनेस के बारे में बात करेंगे कि जो टेक्निकल फ्लॉज है एमसीक्यू में और टेस्ट वाइजनेस रिलेटेड जो कौन कौन से हैं। तो सबसे पहले जो है दिस इज द ग्रामेटिकल जो क्यूज है, इट मीन इसमें ऐसे कोई ऐसे हम दे देते हैं कोई भी इशारा दे देते हैं, क्यूज दे देते हैं जिससे जो स्टूडेंट हैं वो एक अंदाजा लगा सकते हैं, गेस कर सकते हैं कि दैट वुड बी द बेस्ट आंसर। For example, one or more distractors. Distractor mean the wrong option. One is the correct option, and the remaining all are known as the distractors. So one or more distractors don't follow grammatically from the stem, and this often relates to the use of a, an, verb, noun, or singular plural. For example, वहां पे लिखा है कि दिस इज एन डैश। तो आप जो टेस्ट वाइज नहीं, यानी जो स्टूडेंट नीचे गेस करेगा कि वहां पर एन लिखा है, तो दैट्स वाई यहाँ पर सिर्फ वही ऑप्शन आ सकते हैं जो वावेल वर्ड से शुरू होता है। सो अगेन जो है ये एक उसमें से जो नॉन वावेल वावेल वर्ड से शुरू होंगी वो ऑब्वियसली एक्सक्लूड होंगी। तो ये जो है ग्रामेटिकल क्यू है जो टेस्ट वाइजनेस के जुमरे में आते हैं, जो कैटेगरी में आती हैं। सो वर्ब नाउन जो है उसकी भी हो सकती है सिंगुलर प्लूरल। फॉर एग्जांपल यहाँ पर एक एमसीक्यू है कि द इजीएस्ट वे टू गेट एन अपडेट एंड मेडिकल इंफॉर्मेशन इज। यहाँ पर अगर आप देखिए, दैट इज द बुक्स, मेडिकल जर्नल्स, द गाइडलाइंस, द इंटरनेट, द न्यूज़पेपर्स। So in this example, if we look at the books, medical journals, guidelines, and then the last E, newspaper, they all are in plural. See, books से लेकिन single, the internet जो है, this is not in plural, so it is singular. So this is one of the thing, this one is different from the other, and that's why the internet may be the best option to that key. The easiest way to get an update or medical information is, so is जो है that indicate that there should be a singular, as a book हो सकता है, आर बुक्स हो सकते हैं, आर मेडिकल जर्नल्स भी रहेगा। तो इस जो ऊपर लिखा है उससे ये है कि देयर विल बी सिंगुलर, सो दैट्स व्हाई इज द इंटरनेट। तो इस तरह की जो है मिस्टेक जो है स्टूडेंट्स को एक क्यों एक इस तरह एक पॉइंट दे सकते हैं, कुछ इस तरह इन्फो दे रहे जिसकी वजह से वो गेस कर सकते हैं, और गेस करने से क्या होगा, वहां पर ऑब्वियसली जो है जो रिजल्ट्स आएंगी जो वो बायस्ड होंगी, वो सही तरीके से इसकी जो इमेज है वो सही तरीके से वो बयान नहीं कर पाएंगे। इसी तरह जो है लॉजिकल क्यूज है, द मोस्ट ऑफन अकर व्हेन वन ऑफ द ऑप्शंस कंटेन ऑल द अदर ऑप्शंस। सही है, जैसे टेस्ट वाइज स्टूडेंट्स विल सेलेक्ट अमंग सिमिलर ऑप्शंस नॉट आउटलायर ऑप्शन। तो इसमें से एक अगर आप तीन एक जैसे देते हैं और एक जो है बहुत आउटलायर है, तो ऑब्वियसली स्टूडेंट्स जो है या उससे जो क्वेश्चन किया गया है उसमें से कुछ ऑप्शन उसके करीब करीब है और एक जो है जिससे बहुत जो है दूर है, तो ऑब्वियसली जो है वो इससे एक्सक्लूड करेगा। तो इस तरह की भी लॉजिकली जो है ये एक इस तरह के एक पेपर आया था previously फाइनल टाइम एग्जाम में टू द फिफ्थ सेमेस्टर ऑफ डॉक्टर ऑफ फिजिकल थेरेपी, पितारी जी का पेपर था। और टीचर ने जो है पेपर में कुछ इस तरह के एमसीक्यूज, बल्कि बहुत एमसीक्यूज इस तरह थे कि जिसमें सपोज फॉर एग्जांपल मैं एक एग्जांपल दूंगा कि द स्टडी ऑफ डिजीज इज नोन एज। तो उसमें से एक ऑप्शन अगर पिताजी जीता तो दूसरे ऑप्शन उन्होंने मंडे ट्यूसडे थर्सडे इस तरह दी थी। इस तरह बहुत सारे एमसीक्यूज में उन्होंने एक करेक्ट ऑप्शन प्लस डिफरेंट कलर्स नेम, दे रेड ब्लू ब्लैक, इस तरह के भी जो उन्होंने मंथ्स नाम भी दी थी, जनवरी फरवरी मार्च, और एक करेक्ट आंसर होता था। या जो है सीजन के नाम दिए थे कि भाई करेक्ट आंसर उसके साथ जो है स्प्रिंग ऑटम समर विंटर, इस तरह कुछ इस तरह। तो ये जो है लॉजिकली जो है ये आउटलायर्स होते हैं। लॉजिकली जो है द टेस्ट वाइज स्टूडेंट्स विल जस्ट चेक कि ये तो उसके साथ इसका कोई ताल्लुक है नहीं, एंड दैट इज द रीजन उस ऑप्शंस को एक्सक्लूड करेगा एंड बाकी में से सेलेक्ट कर सकेगा। अगेन दिस इज वन ऑफ द टेक्निकल फ्लॉज जो अक्सर होती रहती हैं। So we often have writing difficulty when trying to generate the last option, and often that last option is unrelated to the other option। और ये होता है कि suppose आप लिख देते हैं कि the study of disease is known as so pathology, और फिर आप लिख देते कि भाई this is the anatomy and physiology, और इसमें से आप मैथमेटिक्स लिख देते हैं। तो obviously मैथमेटिक्स जो है this is a subject like these subject but that is unrelated to the these मेडिकल साइंसेस। तो ये है कि बाज़ औक़ात इस तरह होता है कि जब हम कोई लिख दे देते हैं तो पहला हम राइट ऑप्शन लिख देते हैं, उसके साथ एक दो उसकी एक या दो उसकी रिलेवेंट लिख दे, लेकिन फिर एक इस तरह ए फोर या फाइव ऑप्शन हमने बराबर करने होते हैं, तो एंड में एक दो हम इस तरह लिख देते हैं जिसका उस आइटम के साथ बिल्कुल दूर दूर का भी ताल्लुक ना हो। तो अक्सर ये होता है कि इस तरह के भी कुछ एमसीक्यूज होते हैं जिसमें से कुछ ऑप्शन आउटलायर्स होते हैं, और वो आउटलायर की वजह से स्टूडेंट जो है गेस करके इसको एक्सक्लूड कर देते हैं। जैसे फॉर एग्जांपल यहाँ पर अगर हम देखें, वी हैव एन एग्जांपल 20-year-old adolescent attended the A, complaining of the abdominal pain, fatigue, polyuria, and then polydipsia, and then vomiting. On examination, the patient was drowsy and dry. Which of the following changes you expect to see in the blood test? And the options are hyperglycemia, normal glucose level, hypocalcemia, or metabolic alkalosis. In this item, the option A, B, and C, they include all logical possibilities in any patient, which means a human being has either increased blood sugar, normal blood sugar, or decreased blood sugar. Uh, the test-wise students that knows that the correct answer must be A, B, or C, whereas the non-test-wise students spends time concerning the D and E. As the D and E, they are completely different from the other three. And that's why either there will be normal glucose level, either there will be more than normal, either there will be less than normal. इन तीन में तो एक जरूर होगा. So that's why the best answer, the correct answer should be either too much glucose, either less glucose in the blood, or normal glucose. So there is no logic for the correct answer in the hypocalcemia or the metabolic alkalosis. Similarly, another flaws जो है अक्सर MCQs में होती हैं, this is the presence of the absolute terms. What we can call as to what is the absolute term. Absolute term simple mean and it mean uh, always. We can say that all of the always, all of the above, none of the above. All these are also can be. So specifically, the word always or never. These are known as the absolute term, which means, and we also know that in medical sciences there is no always and no, there is possibility of anything. So many higher level ideas, they are not absolutes, never true and always true, are often too absolute. Students are experts at arguing the outlier idea that is outside such absolute. So avoid absolute words and substitute words that require more judgment, which is the best, which is the least likely. And that's why अक्सर एमसीक्यूज में आपने देखा होगा कि the most likely possible diagnosis is the most likely diagnosis is, yeah, the best treatment. It means all of the following there would be the possible treatment, but the best treatment would be. It means there would be a portion of the person correctfulness for all of the five, but one will be the best. We can simply call in medical education these as the BCQ, which means the best choice question, which means okay, all the options there are somehow true, but which one is the most true, which one is the best among all these. So far, here is an example. And deep venous thrombosis, DVT of the lower extremity, which of the following statement is the most appropriate? The options are 70% patient will have physical findings on the examination. The gold standard test for the diagnosis of DVT is the radiofibrinogen leg scanning. Anticoagulant is the treatment of choice for the distal lower extremity DVT, and pulmonary emboli always come from the lower extremity DVT. Now, in this question, the test-wise student, they usually do not select item with the words always or never like in the item D. And instead, they tend to choose items with the word usually or frequently, knowing that the nothing is absolute in the medicine. Similarly, another technical flaw you have, this is the long correct answer. When among there are A, B, C, D. So one option from the four is too much long, and usually that option is correct. So that's why that is a technical flaw which is most commonly present in our MCQs. The correct answer is longer, more specific, or more complete than the other options, and we often feel we should include more detail in the correct answer to ensure that that is the clearly the best choice. This is called the too long to be wrong rule. यानी इसमें इसी जो गलती हम कर लेते हैं कि इसमें से हम जो करेक्ट आंसर होता है उसमें हम कुछ ज्यादा इंफॉर्मेशन दे देता है, तो उसमें इतना वो ज्यादा एनफोर्स में होता है कि वो गलत नहीं हो सकती. दिस इज रूल इज नोन एज द टू लॉन्ग टू बी रॉन्ग रूल. Too long to be wrong rule. Unfortunately, test for students can use this to their advantage. So how we can correct, how we can manage this problem? So there's the keep the options similar in length and level of detail. And that's why there is a term in medical education known as the homogeneous option. Yani there should be homogeneity in the option. That homogeneity may be in their logical sequence, their homogeneity may be in their content relativeness, that may be in their length, they may be in their detail, so they may be in their form and grammar. For example, here is a question which is the patient of a 2-year-old boy reported that he shows entering mean when he is walking. So the big toe that will be pointing outside. Normally, when we are walking, so our big toe that is directed to the outward end, and that angle is almost 7 degree. It means the our foot is being placed at 7 degree from the straight in the outside direction. So normally we are working with the outgoing as up to 7 degree, but in some cases when there is a problem, the patient may work with the toes they are directing to the inside, which is known as the end toeing, and during the working. On examination, the child exhibits femoral introversion. Introversion is another concept in the hip joint in which there is too much interior torsion of the femoral neck. Mostly when that is more than 12 degree, then it is known as the more introversion. Normally it is 12, but if it is less than 12, then it is known as the retroversion. And if it is the more than 12 degree, then it is known as the increase introversion. The most appropriate treatment is the options are reassuring the parents that the condition usually corrects itself as the child grows older, referral to an orthopedist, referral to a physical therapist, bracing to correct internal rotation of the femurs. In these questions, in this long correct answer example, option A is longer than the other options and it is the correct one. Item writers tend to pay more attention to correct answer than to the distractors because uh, as a teacher, we write long correct answers that include additional instruction material, parenthetical information, keywords, etc. But sometimes this can be quite extreme, and this is most common in our paper. So this thing should be avoided when we are when we are constructing our MCQs. Another technical flaws in our MCQs, that is the word repeats. A word or phrase is included in the stem and it is the correct answer, which means जो answer correct answer होता है वो पहले से stem में मौजूद होता है. Student look for words or phrases that are repeated in the question and option. The more repeating, the more likely it is the right answer. For example, here is a question which is a 58-year-old man with a history of heavy alcohol use and previous psychiatric hospitalization is confused and agitated. He speaks of experience the world is unreal. This symptom is called, and the options are depersonalization, derailment, derailment, derealization, focal memory deficit, and signal anxiety. If we look at the options, there is an option C, derealization, and here in the item, in the second sentence, there is he speaks of experience the world is unreal. So unreal and derealization, they're somehow related to each other. They are giving the same meaning, unreal and derealization. So that is actually word repeat technical flaw, and this is an example of that. When there is repetition of words in the item and in the option, so this should be avoided as possible. Another technical flaw is this is the convergence strategy. The correct answer include the most elements in common with the other options. The student will select the answer that combines the most element in all options. The correct answer most likely is the one that combines the most number of common elements from the other distractors. If a word occurs in most of the options, most likely the correct answer will contain that word. If a term appears only in one option, then that probably is not the correct answer. And that will be clear from this example. ये इस तरह की जो कन्वर्जेंस स्ट्रेटेजी होती हैं ये उन एमसीक्यूज में होती हैं व्हेन वी हैव three or more than three words in the options. Just for example, here we have active, artificial, congenital immunity. There are three words. Sometimes there may be four or five. That may be the sequence. There may be the uh, words which are properties, yeah, characteristic of a condition, symptoms of a conditions. So it means when we have a lot of options here in the a lot of mean three or more than three. So those words which are most commonly repeated in there will be the including in the best answer. If there is a single word which is present in a single option, then that will be not the part of the just in that correct answer. Just for example, oral polio vaccine (OPV) induces specific active artificial congenital immunity, active artificial acquired immunity, passive artificial acquired immunity, active natural acquired immunity, and passive natural acquired immunity. Now, अगर हम यहाँ पे देखें इन चार ऑप्शंस में एक्वायर्ड इम्यूनिटी एक्वायर्ड इम्यूनिटी एक्वायर्ड इम्यूनिटी एक्वायर्ड इम्यूनिटी ये सबसे ज्यादा रिपीट हुआ है विच मीन दैट दैट वुड बी द करेक्ट आंसर फिर अगर हम देखें इसमें से आर्टिफिशियल जो है ये आर्टिफिशियल 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 सो ये तीन बार रिपीट हो चुका है और फिर एक्टिव 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 ये भी तीन बार रिपीट हो चुका है तो ये सबसे ये वर्ड्स है जो सबसे ज्यादा रिपीट हो चुके हैं एंड दैट इज द प्रॉब्लम कि इन तमाम में जो कॉमन वर्ड्स है दैट इज एक्वायर्ड इम्यूनिटी दैट वाज आर्टिफिशियल एंड दैट वाज एक्टिव और ये सिर्फ और सिर्फ बी में ये तीनों कंबाइन हो रहे हैं which is the active artificial and acquired immunity and that is the correct option. अक्सर हम इस तरह करते हैं कि हम करेक्ट आंसर लिख देते हैं और फिर इसमें से नेक्स्ट में से एक चीज चेंज करते ये दोनों सेम रहते हैं फिर इसमें से आर्टिफिशियल चेंज करके ये दोनों सेम रहते हैं यानी कुछ वर्ड्स इसमें जिस तरह एक्वायर्ड इम्यूनिटी देखे ना इन सब में रिपीट हो रही है विच सिंपली मीन दैट दैट वुड बी द करेक्ट आंसर. So in this question, the correct answer is the option B. And the underlying premise is that the correct answer is the option that has the most element in common with the other option. And it is not likely to be an outsider, which we have discussed in detail in the previous slide. Now, there are some other flaws, technical flaws, which are related to the irrelevant difficulty. Uh, Previously, जो हमने discuss किया, that is convergence strategy, words repetition, long correct answer, absolute term, or the logical cues, or the grammatical cues, they all were related to the test wiseness. Now we will discuss the technical flaws which are related to the irrelevant difficulty, and among them when options are long, complicated, or double. For example, this is an example. Peer review committees in the HMOs may move to take action against a physician credentials to care for the participants of the HMO. This is an administrative requirement to ensure that the physician receives due process in the course of these activities. A due process must include which of the following, and then the options notice an impartial forum, counsel, a chance to hear and confront evidence against him, her, and so on. If we look at this question, the options are very long, and not only very long, they are complicated as well. And trying to decide among these options requires a significant amount of reading, and that will obviously also requires a amount of time because the number of elements in each options they are too long. This can shift what is measured in an item from knowledge to the content to reading speed. It mean somehow. I mean, some people they are more speedy in reading. They will have the correct answer quickly than those who are they are not too quickly in reading. So it means we are checking something else other than the knowledge. The second flaw in this item is the only options A and B follow logically from the stem, while option C, D, and E they are not directly related to the purpose of the healthcare planners in the stem. A careful look to the option C shows that there are two facts, uh, we can say double facts, that need to be judged by the student. Double fact in option introduce difficulty when the fact is true and the other is wrong. As a rule, if you need to test knowledge of two facts, each one should be made into an option. And this one that should be avoided. The options are too long, they are complicated, or they are double, which mean the double facts. Here's an examples of another example of that technical flaw when the options are long. A team of healthcare planners wishes to estimate the prevalence and incidence of AIDS in a particular community. Which of the following is the most appropriate? So if we look at the A, B, C, D, E, all they have a paragraphs of, they are not single option, they are paragraphs. So reading them is taking too much time, as well as the person who is they have the capacity of quick reading and understanding, and then the deriving the meaning from that. So that is we are going to test something is other than the knowledge. So these such type of MCQs that should be avoided in the exams and the test. Sometimes the options they are in the illogical order. For example, it is a good practice to be consistent in the use of alphabetical order. Whenever options are in spectrum, it is preferable to list them in either a logical order or alphabetically. And alphabetical order is the most commonly and the best option to treat and to manage such pathologies. For instance, numeric options should be listed in ascending or descending order. Logical order is most convenient for the students and eliminates the human bias. For example, here is an example is the end arteries are seen in the adrenals, testicles, thyroid gland, thymus, and brain. In this case, it is easier to follow and read if the options are arranged from top down in this order, like the brain, thyroid, thymus, adrenal, and then the testicles. So there should be a logical order, and these logical order they may be in the alphabetical form. That may be a logical order. Like this is the logical order, which means that the brain is on the top, then the thyroid, then the thymus, then the adrenal, then the testicle. Similarly, there should be descending ascending order if the options are numeric, and all these will help in the elimination of the human bias in selecting uh, the correct answer. Options are not parallel, mean there is too much heterogeneity in the options. The options following a stem belong to different categories. This is one of the frequently encountered mistakes. For example, here is an example. A 75-year-old woman complains of severe neck and shoulder pain. You suspect polymyalgia. Which one of the following is the most appropriate? And these are the options. The shoulder girdle muscle tenderness is not related to the condition. Loss of fat and fever should be expected. Urine is likely to contain Benz-Jones protein. Muscle biopsy is positive, and steroid produce a very prompt symptomatic response, but most must be continued for up to 3 months in this condition. If we look at these options, there is a lot of heterogeneity in the options, and that heterogeneity is the response option in this example, they are not parallel. The options A and B, they are about the clinical features, and option C and D, they are about the laboratory investigation, while the option E, that is about the management. So it means there is no logical connection between these options. So there should be a logical order. There all are to be all the options should be related to investigation. All options should be related to the management. All options should be related to sign and symptoms. All options should be related to the clinical features and manifestation. So then, if we have followed that, then we can say that there is homogeneity in the option. So the term for these flaws, this is the when there is heterogeneity in our option. None of the above or all of the above are option A and B. ये बहुत common होता है ये जब हम MCQs बनाते हैं and we have very less time और या हम ऐसे option बना लेते हैं कि जिसमें से हमारे लिए homogeneous आंसर जो है ये option जो है ये बनाना मुश्किल हो जाता है and we are trying to avoid the heterogeneity. तो आउटलायर्स हम नहीं डालना चाहते तो फिर हम क्या करते हैं हम कहते हैं कि both A and B, all of the above, none of the above, A and B, एंड सी। तो ये जो है ये अक्सर होते हैं जैसे फॉर एग्जांपल यहाँ पर देखिए चिकन पॉक्स इज caused by the same virus that causes different condition herpes simplex, labialis, herpes zoster and herpetic stomatitis. Then the options they are all of the above, none of the above. So it means the students either they will think they're either uh, the answer is either null, all of the above, yeah, none of the above. Because if all these three are correct, so this is all of the above, and if no one is from the list, so there will be none of the above. So it means again there is no need of writing these. Instead of that, you can write another in a condition, another infection which is caused by the other virus, not by the same virus. So that will be the most best solution to such MCQs. So as a teacher, we should avoid none of the above, all of the above, option A and B. And this one is one of those technical flaws which is most frequently occurring in our MCQs. Numeric data are stated consistently. When numeric data are used, they should be listed in numeric order in a single format. For example, they all should be in ranges, or should be in percentages, or should be in a single digit only, or should be in a single format. Mean some are in the percentages, some are in the single digits, some are in the ranges. So that will again there is no consistency. So there should be consistency between the numerical options. Confusion occurs when formats they are mixed and when the options are listed in an illogical order or in inconsistent format. For example, here is a MCQ. A 25-year-old woman delivered a boy with Down syndrome. She is depressed and asks you what is the likelihood of her having another child with a similar condition. Your answer will be 2%, 5%, 25%, less than 10%, 15 to 18%. In this example, the option D and E, they are expressed as ranges. It means less than 10% and 15 to 18%. And they are not specific percentages. All options should be expressed either as ranges or as specific percentages. Absolute numbers should be used when there is a consensus on their value. Otherwise, it is better to use ranges to avoid differences between sources, and that may confuse the student. In addition, the range for option D include option A and B, which is not advisable. If we look at here, less than 10, option 2 and 5%, they both are in less than 10%. So it means if these less 2%, 5%, instead of that, that is the options equal to these two options less than 10%. So therefore, there should be consistency in writing the numerical data. The format should be uniform from top to there should be an consistency as well as the format should be uniform. Either if they are writing at the solo digit, if they are read in the ranges, and ranges are better just because different findings may be reviewed in different studies. So that's why to avoid such confusion, a wide range and the possible range for those values should be used. Now here is just an example. Examples हम discuss करेंगे कि इसमें कौन सी flaws, and then in the next slide we will discuss इसमें कौन सी flaw है. So यहाँ पर एक MCQ है. DOTS is the most effective treatment in HIV, AIDS, leishmaniasis, malaria, and schistosomiasis and tuberculosis. So these are the different condition in which the drugs may be the most effective treatment. So यहाँ पर आप देखिए is the most effective. यहाँ पर the only effective treatment नहीं है, absolute term यहाँ पर नहीं है. So that flaw तो इधर है नहीं. फिर क्या फ्लॉज उसमें हो सकती हैं इसमें उसमें ट्रू सीक्वेंस वाली बात जो है वो भी नहीं है. ऑल ऑफ देम दे आर कंडीशंस, होमोजेनिसिटी भी है, ट्रू लॉन्ग वाली बात भी नहीं है, सीक्वेंस और भी नहीं है. तो फ्लॉ कहाँ पर है? सो द आंसर इज this is a single correct MCQ rather than single best answer because options are either 100% true or 100% false. Another point is the item test recall of knowledge rather than application of knowledge. This problem could be avoided by using clinical vanities or the patient scenarios. When you are discussing the second session, in that session we discuss that if we are going to discuss a question about the diagnosis or treatment, then instead of that context free item we should add the context rich item, and that context rich item is when the answer is vanity. If are asking about the effective treatment, asking about the what is the most likely the diagnosis, so the vanity should be, and we have shared the worksheet as well for writing the vanity. So this is the flaw in that the MCQ, this is which is the context free, that should be context rich, they should be in the vanity format. Note another problem in flaw in the MCQs is note that the abbreviation dots has not been spelled out. It stands for the directly absorbed therapy short course. This is a common mistake. It represents irrelevant difficulty unless the aim of the question is to test the student knowledge in standard abbreviations. Some MCQs, some abbreviations, they are very common and that is understandable to every person. Just for example, CVA, yeah, just for example, DVT. But some abbreviations, they are not so common and that may create confusion and difficulty for the exam and students. So that's why if an MCQ and an MCQ, if abbreviation is common or not common, it's creating confusion or not creating confusion, it should be written in the full form rather than its short form. This is another MCQ. A 2-year-old girl brought to the emergency department because of several thin wall 1 to 2 cm blisters and on her face and several crusted honey-colored and weeping lesions on her arm. The patient is febrile and has no associated lymphadenopathy. Which of the following statements concerning the most likely etiology for this finding is correct? अगेन जो पहले में हमने फ्लॉ आइडेंटिफाई किया कि देयर शुड बी अविनिटी, तो यहाँ पर ओ फ्लॉ तो नहीं है. अब यहाँ पर कौन सी फ्लॉ हो सकती है? तो यहाँ पर अगर आप इवन एक दूसरी भी देख सकते हैं कि लेंथ भी हो सकती है, और इसमें जो है जो पॉसिबल फ्लॉज है और क्या क्या हो सकते हैं. सो लेट्स सी. Options, they are not consistent with the lead in statement. None of the options mention the most likely etiology in the case. Similarly, the options are not homogeneous. One of them is about etiology, the second one is about complication, and the others are management. So, pehla one jo hai, this is, it probably indicates angina pectoris, coronary is indicated. So, and another clause, sorry, this one is. अनदर फ्लॉज जो है इसमें ये है कि ये इसमें एक में जो कंडीशंस होते हैं, यानी हमने पहले कहा था कि जो हेट्रोजेनिसिटी यहाँ पर है, तो हेट्रोजेनिसिटी के साथ साथ वन ऑप्शन इज टू मच लॉन्ग, दैट इज एन डबल लाइन, देन अदर वन, तो ये भी हो सकती है. This is a true false rather than single best answer question. So again, the main flaw here in this MCQ, that was the heterogeneity which was present there. The patient subsequently has an experience tolerance test which reveals exercise tolerance test, which is known as the ETT, which reveals a 2.5 MST segment depression at the METs of activity, which simply medical equivalent, metabolic equivalent, which is the MET and the currency of the expression of the energy consumption. Objectivity is the patient achieves 50% of his age predicted maximum heart rate. Which of the following statement regarding this test is all true? Again, if we look at to this options, there is a flaw which is A and B, all of the above statement true. ये यहाँ पर आ रहा है. Another flaw जो यहाँ पर नजर आ रही है वो यहाँ पे two lengths. If you look at the option C, that is too much lengthy as compared to the other one. Let's see what are the answer to what are the different flaws in this MCQ3. The paragraph the patient subsequently indicates that this question is a continuation of a previous question that was not shown here. Again, subsequently mean if events which are occurring as a result of the previous, so that is not present here. So again, this is one of the flaw. All of the above statements are true and A and B options are used. This is one of the flaws discussed earlier. Option C is much longer and more detailed than the other options. So, and these options are not homogeneous as well. So again, there is a heterogeneity in this question. Which of the following is are a clinical hallmark of asthma? Cough, nocturnal dyspnea, shortness of breath, wheezing, A, C and G. Again, वही टेक्निकल फ्लॉ इसमें आ रही है कि यहाँ पर A, C and D भी हैं and यहाँ पर हमने एक clinical mark भी लिखे तो that again give one of the grammatical flaw as well. So देखते हैं कि क्या क्या इसमें है. The item test recall of knowledge as there is no patient scenario for the application of knowledge. Option E is a combination of multiple options. If the student knows two options are is correct, it is inevitable that the answer is the correct answer is the E. It is clear that R has been introduced to avoid grammar non-matching option E. A stem that contains single and plural form is difficult to read. So that is again a flaw which has been there. Again, this is Vinity, a 17-year-old lady is brought into her office with a 3-day history of nausea, and again all of the different examination points are from there. Then there are options A, B, and C, and D and E. The D and E options again, this is the combination of two of the A and B and C, which I have discussed earlier, as well as it seemed that the option B is too much longer than the others. So again, this is another flaw in this MCQ. So the correct answer B is longer, more complete, and more specific than the other option, and it is related to that test wiseness when the students they will uh, identify that this is the correct because this is the longer and it contains the more information. And B and C are used in the options. This is one of the flaws which we discussed previously. These were some of the commonly mistakes and flaws when we have an MCQ during the construction of them. So as a teacher, we should try to be, our MCQ should be clear of these flaws. We should at least try to eliminate these mistakes to our best. What are the general guidelines of writing the MCQ? That is how we can construct the last objective of this lecture, that how we can construct an effective MCQ to our students of health sciences. Include as much of the item as possible in the stem, long stem, short options. There should be the general, and it means that more the options, more the information in the question, it will be clear, and it will be make it easier for the student to select. Sorry if there was some interruption in the internet. We are almost at the end of this session. तो जनरल गाइडलाइंस हम डिस्कस कर रहे थे इसमें हमने कहा कि लॉन्ग स्ट्रिंग्स होनी चाहिए एंड शॉर्ट ऑप्शन होनी चाहिए. Avoid negatively pressed items except or not in the lead, and if you must use only with short option. Avoid writing question of the form, which of the following statement is correct? Each of the following statement is correct, except ये बहुत commonly होते हैं when we are as a teacher constructing the MCQ, that all of the following statements are true except one. And regarding, suppose for example, uh, regarding the stroke, all of the following they are true except one. So इस तरह की जो है ये भी avoid होनी चाहिए. These are um, creating biasness, and again this is will have some flaws in it. The options should be written in ascending order, short option to long one. Top down versus bottom up. Top down mean knowledge or recall question, cite a disease, and then ask what patient find unexpected structure like the test book clinically backward. Bottom up mean application of knowledge gives findings and asks examiner to indicate the disease. Examiner need to be able to synthesize information from several pages of a test book or notes to answer these questions clinically realistic. So again, जो है bottom option जो है, and this is much more better than the top down. So this is we have discussed all about the structure of MCQs. Before that, we discussed what is MCQ, the types of MCQ. Then we discussed the pathology MCQ, then how we can manage, how we can treat and try to have a solution for these pathologies, these problems. Then we discussed the commonly technical flaws in the MCQs when we are constructing them, and then how we can remove them. And we discussed them with examples. Now there is an assignment to all of you. That is, select a topic from one of your subjects and construct MCQ of 5 choice alternatives. Try to write MCQ without flaws. The second task is write 2 MCQ with flaws and identify the flaws in it. So it means you have to construct 7 MCQs. Among those 7, 5 of them should be clear of any technical flaws, and 2 of them they should have any flaw, and you have to identify that which flaw has been there in this question. That was all about the MCQ multiple choice question. Thank you so much to all of you.